Floyd had a great result. My patient had a great result. We need you, KSI, in this clinic next. Hey guys, Dr. Gary here. As many of you know, I put it out there that KSI can come to my clinic in Manhattan and we will do his beard hair transplant at cost or for free, whatever it ends up being. I think that it would be a really cool experience for him. It would definitely be great exposure for my practice. He went out there and said to all his fans, like, hey guys, you know, I'm here and I want more beard hair.
Hey guys, how's it going? I'm thinking about getting a beard transplant because my beard's just so clapped, isn't it? I just got some dead ass beard.
So yeah, we can do it. I just wanted to kind of cover a couple of things in this video, all about beard transplant, okay? It actually made it onto Reddit about how we were offering KSI this surgery, and the topic here, someone posted it, was, we need to get our man a good beard ASAP. This man, referring to me, wants to give JJ a Chad beard. So I found it funny, like looking through some of the comments, so I just wanted to point out some of my favorites, the appropriate ones. I won't go over the inappropriate ones. It goes, "Mans needs to fix his head first, then move on to JJ." We talk about this a lot on my channel, but I've got alopecia areata. So as many of you know, I have alopecia areata, which is a type of autoimmune condition where the body attacks its own hair follicles. So it's not something you just kind of fix with a hair transplant. It's an autoimmune type of hair loss condition. So it's different from what JJ has or what most people have when they go in for hair transplant. That's androgenic alopecia. That's like a more hereditary, you know, testosterone sort of driven type of hair loss, as opposed to mine, which is like the body attacking itself. So very different, but you know, it kind of made me giggle that some people are a little naive when it comes to the different types of hair loss. Someone wrote, "I don't want to be rude or anything, but I think this guy needs a consultation first." So again, same theme there. But I have to say, a lot of people came to my defense here. Someone wrote, "Bro, he's got alopecia." Alopecia, again, is just the general term. My condition's alopecia areata, but that's fine. And then my favorite comment here was by Daddy Longlegs 393. "My man out here looking like a zested lemon," which I thought was hilarious. So that was a lot of fun. So again, you know, the offer is out there. We've put out a TikTok about my most recent beard hair transplant. I'm going to be covering some of those clips now, just kind of walking you guys through the process. But you know, people were commenting on that video that, like, yeah, let KSI know, someone should post this, whatever, to Reddit, which it already was on Reddit. I don't think he's seen it. Maybe he has, and he's just like, yeah, I don't actually want to get a transplant. But you know, he asked his fans, like, well, what should I do? And when you have a patchy beard, I mean, there aren't too many options other than shaving it off or getting a transplant if you're a transplant candidate, which it appears that he might be. Now, I wanted to cover, as part of this video, also about Floyd Mayweather. As you guys might remember, I made a video about Floyd's speculation around his beard and scalp hair transplant. And so he recently posted, I'm going to bring it up now, an updated photo to his Instagram of how he looks. You know, I don't know how long it's been since the purported transplant, but probably about a year. And I gotta say, he's here in South Beach, Miami, with cameras behind him, and I think he's looking very good. When I compare this photo, kind of more recent Instagram photo, to the photo that I used to do my analysis the last time, I'm really seeing that the hair, those little kind of like crusty areas where you guys got to see where like they most likely put the hair into the beard, that's coinciding with where I'm seeing the hair growing now. So that's one thing that kind of gives it away, in my opinion, that he likely did have the hair transplant, a successful one at that. The other thing is, if you notice, his goatee area is very strong and dense. The hair there is very thick, and that's his natural hair. The hair that's transplanted, you can see it's just not quite as dense, right? Because the number of grafts that are packed in there compared to his native is just not as dense, and that's normal. I mean, that's what happens with transplants quite frequently, because we only have a limited donor supply, and it looks like he also had hair placed in here. So again, there's a limit to how many grafts you can then put into the beard. But overall, I think it's a great result. And also, like, I'm seeing that in the central cheek area, there's a little bit of kind of see-through sort of patchiness in areas, and sometimes that happens. Not every hair is going to grow with a transplant, whether it's on the scalp or the beard, and the beard area, it's sometimes a little bit more obvious, or like for the eyebrows, for example, when hair doesn't grow out fully. But overall, I mean, I think especially from this angle, a profile shot, he looks great. And, you know, he's got those shiny white teeth. I think Floyd's looking real good. So that's the update on Floyd Mayweather. And then I wanted to walk you guys through a recent beard hair transplant that I did, and it kind of made me think about those other two scenarios with KSI, with Floyd Mayweather. It's becoming more popular, you know, and I'm doing a lot of these, and, you know, people from all different backgrounds are interested in it. And we had one case not too long ago where a gentleman had a big scar along the lower part of his cheek, and so he had laser treatments and surgeries, and, you know, he just had a big missing area of like scar and no hair, but he had, you know, beard hair all around. So I actually transplanted the scar. So we're waiting to see how it all grows out. But so sometimes this these transplants can be used for reconstructive purposes, not just purely sort of beautification and sort of like purely cosmetic. There are sort of reconstructive approaches to it as well. So let me go through this briefly with you guys. This is what we posted on TikTok and on Instagram of a recent beard hair transplant of mine. So it starts off with the outline of where I'm planning to place the grafts. This part's like the most important part. It's what I do with the patients in the morning, and you really want to make sure you have a game plan of where you're putting grafts. Of course, you have to keep in mind how many grafts you're doing overall, and that comes down to like what were they willing to pay for, and also what are you set up for that day, and how many grafts do they have. So a lot of that we decide in advance during the consultation, and then day of we have to actually map it out and, you know, kind of put it all together. So these markings are super critical. This gentleman wanted kind of a thinner sideburn area. He didn't want it too thick, and he was reasonable with how much width to create. So it's not too different from the width of the cheek of what like Floyd Mayweather had. Maybe not quite as tall, but similar. The broader you go, the more coverage that you're trying to obtain, the less dense you're going to be able to go with the same number of grafts. So in this case we had about 1,000 grafts to work with. So if I'm covering an area that's this big, it's going to be less dense with those 1,000 grafts than an area that's this big, which seems like really intuitive and common sense, but, you know, that factors into how we design the recipient area, which in this case is the beard, and a lot of things that it impacts. So just something that's super important for patients to understand, and just anyone else to understand. So we're progressing through. You can see here the markings are extending into these kind of triangular regions that are just kind of on the side of like the goatee area, and we just felt like we should strengthen those areas. So that's why the markings are extending out to there. Now that's the left side, and you can see like in terms of how far down to go, we don't want to put hair on the neck. I mean, most guys want to get hair off the neck, so we kind of just go right up to the mandibular border, which is like just beyond it, so it still looks like a smooth transition. That's the lower aspect of it. So now what you're seeing here is like the grafts, actually they're getting inserted into all these little slits that I made. So I go into the predefined area, and I make all of these little blade sites. So there's little cuts essentially into the skin at a very specific angle. It's got to be very flat to the face. You don't want to be sticking out, because then when it grows in, it looks unnatural. And so that's how we make all these little cuts. Obviously, once the person is numb, you're not going to do it with no anesthesia.
I'm actually not going to be taking any of those.
So we have all the sites, and now the grafts are going in one by one. So the technician here, my tech, has the grafts on his finger, and he is keeping them moist, which is very important because you don't want the grafts to get dry and not, you know, survive. And then very carefully with forceps, those grafts are getting placed into those recipient sites one by one. So you can see it here. It's a very tedious process. They make it look easy. That's what's going on there. And now all those grafts have been placed, and you can see how fairly evenly we've gotten the distribution throughout the whole kind of beard area. And even though 1,000 grafts, maybe to some it sounds like a lot, but to me, I know, you know, it's not like the biggest number in the world, but, you know, I think this will work well for him. I mean, it's growing out now. He's only about 1 month out, so we'll keep you posted on his results. But the thing is also, he's got curly hair, and curly hair provides more coverage than like thinner straight hair. So you can get away with fewer grafts and still do a really nice job for someone. So here it is spanning from the right side, it's going to the left side, and you can really see how we've evenly distributed the grafts. That's the most important part. Knowing what you're starting with, what territory you're going after in terms of filling, and just doing the best job you can, and then properly instructing patients on what to do afterwards to preserve that hair. So Floyd had a great result. My patient had a great result. We need you, KSI, in this clinic next. See you soon.